Greetings from sunny Finland. Up next, Dara Baldwin from the Center for Disability Rights will share an interactive session on disability. This will include the issues, a brief overview of US laws, and how race and activism in the US around disability has changed in the last 5 years. In the session, Dara will discuss a brief disability history, which includes a review of disability right laws, the definition of disability, disability etiquette, and an overview of disability issues using the framework of intersectionality and race. Enjoy.
Okay, everyone, welcome to the No Labels, No Walls Festival. We're very lucky to have Dara here today talking about disability in the United States. So welcome, Dara. Thanks a lot for this.
Thank you. Thank you for having me. Peace and blessings, everyone. Power to the people. I'm Dara Baldwin, the Director of National Policy for the Center for Disability Rights. I live and work in Washington, D.C., D.C. statehood, D.C. statehood, D.C. statehood. I must say that we're not a state. And for those of you who know the United States, there are 50 of them, and we will be 51. So I'm here to talk to you today about disability history and rights and the difference between disability rights and disability justice here in the United States. First, I want to say thank you to the whole entire team of No Labels, No Walls, especially Michael, for having me here. And I just also want to send out peace and blessings to everyone in the world as we go through this pandemic. It is a serious time in all of our lives. And it is a time for us to come together. And I'm enjoying the whole festival and what this means. We are all here together on this earth, and we must all go through these things together, but we also must celebrate each other and know that there is a future of wonder. So I just want to talk about, this is me. You will see a PowerPoint presentation up. When this presentation is over, it will be up in your resource areas for the festival. Please at any time contact me or any of the people on these slides, and as well as click onto the links to the wonderful websites and information that I'm going to provide. I, again, am the Director of National Policy, which means that I live and work in DC because I work with our United States House of Representatives and Senate, which is the Congress, as well as the White House. I work on presenting to them information so that we can pass laws that help disabled people. I currently center my work on Black and brown bodies, and I work to end systems of oppression and racism. So I'm also a co-conspirator of the newly created Black Disabled Lives Matters, which you will see there. So this is a saying that was sent to me by someone who spent almost 12 years of his life in solitary confinement. Unfortunately, here in the United States, we still have that. And he spent it in prison in a place 6 feet under. He spent 22 hours a day there. They let him out for 2 hours a day. And he said that this quote got him through it. It's from Steve Jobs, who always thought of himself as a square peg being tried to put into a round hole. And I think that's what people do with disabilities and people with disabilities. And we must understand that that is not how this goes, that the world needs to adjust to disabled folks and that the disabled people are just fine the way they are. And I just changed the words to extremely enthusiastic because Steve Jobs used the word crazy, which we do not use. That is a horrible word to use. It is discriminatory. So I just wanted to say that. This is what I'll talk about real quick today. And then we'll get to it. If you have any questions, please put them in the chat box and we'll get to your questions and we'll answer, I'll answer them. I don't want to lecture to people. I want this to be interactive. So just let me know and we'll get to your, I can see the chat and I can go to that and talk to people. Okay. So I do my work from a place of inclusion and justice and fairness. And I include everyone. So that's what that is there. I also hold on, sorry, I don't know what move, work on about 12 different issue areas, criminal justice. We're doing ending that, right? The justice reform and policing and what's happening in the United States around the killing of Black and brown bodies. I also work on housing and civil rights and voting rights, all of those issue areas. So that's there. Let me go into our history and disability rights. So many of you have probably heard of the ADA, the Americans with Disabilities Act, which passed in 1990, just celebrated its 30th anniversary. People think that, oh, that just happened and it just came about. That is not true. Let me give a little history. In 1968, they created the Architectural Barrier Act. Also, people think the ADA is about ramps and doors. That's not true. This is where the ramps and doors came in. And then what they said was the ramps had to be wide enough and the doors had to be wide enough and the ramps you had to have ramps. Then you had the Rehabilitation Act of 1974, Section 504, which gave people a civil right only for federally funded entities. So let me explain this. So in 1968, they had the ramps and the doors, and then also in 1974, they did this bill. What that meant was, an example I give is, you have Jane Doe, John Doe, they, who wanted to go to a university. So the ramps and doors were there, but they could not get an education in the school because there was no civil right. So they get into the classroom and the professor says, I don't want to teach you. I don't teach people like you. You must leave. They had the right to do that. Then in 1974, because the Rehab Act said, if you receive federal funds, which is money from the government, United States government gives you money and you take it, then you must educate a disabled person. You must provide them service. What that means is that, there's no university in the United States that doesn't take funding, if for nothing else, to do research, right? Or to house people or to feed people. So once that happened, Jane, John Doe, they went into the class, went to the school, went to the classroom. The professor could no longer say, I'm not going to teach them. But if their fellow students wanted to take them to the McDonald's across the street or to a restaurant across the street that wasn't accessible, they could still say, nope, we don't serve those kinds of people here. Or their door wasn't wide enough, or their ramp wasn't there. And they had every right, the owner of that restaurant had every right, because they're not receiving federal funds. That's a private entity, a private business. So they still had no civil or human right in the United States. 1986, they passed the Air Carrier Access Act, which made airlines are supposed to be accessible. For those of you across the pond in other countries, many of your airplanes are accessible. Unfortunately, in the United States, that still has not happened from 1986. We're still waiting for that. So then they created the Americans with Disabilities Act in 1990, which gave disabled people in this country a civil right. And that meant they could go to the class in school and go with their friends to any restaurant they wanted to, as long as it was accessible, was right. Enforcing a law is different, but the owner couldn't say people like you can't come in here. That gave them a civil and human right in the United States. That was July 26, 1990, only 30 years ago. This country has been around since 1776, so you understand that. And we just celebrated the ADA. There are 5 titles to the ADA, which are talk about employment, talk about education, talk about public accommodation. It covers many different things. What it has not covered was was housing, which was under the Fair Housing Act, and a lot of transportation is under there. And then they have Title V, which covers kind of like all kinds of things. Title III of the ADA covers private entities, those restaurants. But I want you to understand and know, as I said, the ADA was not about doors and ramps. The ADA is about community integration, because in this country in the early 1900s and beyond, what we did with disabled people was put them in institutions. We also unfortunately had in 1876, the first city, San Francisco, California, created what's called the Ugly Laws. And the Ugly Laws stated that people with disabilities were not allowed to be on the streets or in public spaces. And so therefore they were sent to institutions. And so community integration says that people with disabilities, no matter what their disability is, have the right to live in the community, safe, like all of us, and to accomplish any of the things that we accomplish: education, housing. And I say we because I'm not a person with a disability. So disability history and how we got there is very fascinating. Unfortunately, if you read about the disability rights movement in the United States, it is completely white. You will only hear about white people, and that only white folks really helped to push the ADA and the disability rights movement. And that is not true. These are some of the organizations you will see: Lead On Network, and the NDLA, the Harriet Tubman Collaborative, and a young lady named Vilisa Thompson created the hashtag Disability2 TOO White. It's in its 3rd anniversary. We also wrote a statement about this racism and bias in the disability rights community in October 2016. It is a shame to say that even today, with all the things that are going on about racism and race in the United States, after the horrific killing of Breonna Taylor and George Floyd and many others, and some trans women and men, by police officers in this country, and now we're talking about race, even now in the disability rights community, they don't want to discuss that. They don't find themselves to be racist or that they can in any way be privileged. They always say that, you know, we're disabled, so how can we be racist or privileged, when they don't understand that racism and privilege have nothing to do with your status in life. It has to do with your race, your skin of your color, the color of your skin. So that's what that has to do with. Also in disability movement and work, there are 3 avenues to this work. One is paternalistic. Woe is we, and we have to take care of them. You may have seen organizations like VOR, they use the R word, which we don't use anymore, or Autism Speaks, which is, you know, another organization, or NAMNI, those kind of organizations who put forward families before anything. It's what the parents and what the people want, not centered on disabled folks. Then you have clinical, which is we can cure or fix them. Again, groups like Autism Speaks with that blue puzzle and trying to fix people with autism. If you don't take anything else away from this conversation, there's nothing wrong with having a disability. Let me say that again and be very clear. There is nothing wrong with having a disability. They are beautiful people, just like everyone else. For many, many years, they told my people, Black folks, there was something wrong with us. People say to me, do you believe there's nothing wrong with disabled folks? My grandfather, my mother's father, was told he would never be anything. He was told to leave 8th grade. And here we are 3 generations later. My mother, actually one, his daughter had her EDD. She was a doctorate, right? I have a master's degree. We had a Black man become president of the United States. They told Black people they would never be anything and that they were horrible people, and we are not. So I don't believe that. Disabled folks can and will be whatever they wish, and there is nothing wrong with having a disability. So there's nothing to cure or fix about them. Now, we understand that some people may have a disease that may kill them, and we agree with that. Help them out and make them healthy. But there's also clinicians around the world who are trying to wipe away disabilities through genetics. And we don't believe in that either. Now, we don't believe, and I don't believe in telling someone what to do with their body. If someone does not wish to have a child with a disability, that is their choice. What we are against is the state, the government telling people you will not have disabled babies. That we don't support. We don't support any kind of genetic cleansing of bodies and cells and people having children that way done by the state. So we fight for that. And then the third way is civil and human rights. And that is how we fight our work, through civil and human rights, meaning that all people with disabilities have the right to everything else that we have: education, housing, transportation, travel, all of those things. That is how we believe in this. I'm going to ask, are there any questions in the chat box?
Not as yet, I don't think.
Okay, no problem. Just let me know when there are. Oh.
Yeah.
Okay, thank you. So the disability rights movement, Lead On, you saw this is a group. When you get this slide, you can click on here. Lead On is a group that was started by Black and Brown disabled people about 6 years ago. And if you go to our website, I helped out to get it started, you will find a list of Black and Brown people, BIPOC is now we're saying Black, Indigenous people of color, who have helped out with disability rights around the country, around the United States at least, over the years. It's a very, very good list. I discussed the titles of the ADA. So you'll see there, Title I is about employment and Title II is public entities. Title III is what I'm saying is about private entities. Just so you know, the ADA was kind of almost the last civil rights written in this country. So it is written really well. Many people use it as a model around the world to write public accommodation language. Even the civil rights of 1964 wasn't tight enough, and they couldn't get everything they wanted in it, so they put it in the ADA. The last group of people in this country that we need to make sure they have a civil and human right are our LGBTQ and plus people. They don't have a civil right yet in this country. So that's there. So now I'm going to talk to you guys about disability justice and disability rights, the difference between the two. I explained disability rights a little bit earlier. Disability justice grew out of the frustration and anger to the disability rights movement that I just talked about, and the erasure of multi-marginalized people, specifically Black and Brown people. And what do I mean by the erasure of Black and Brown people? As I said, if you read any books, one book is No Pity by Joe Shapiro, which is in the resources of this, and I will give it to you. And Joe is a NPR news reporter who does disabilities. He has a sister with a disability. He's a good friend of ours. He knows when I say, because I say it to him all the time. His book is completely based on white people. There are no Black people that he lists or talks about who helped out with the ADA, the fight. That is not true. We know for a fact that the Black Panthers here in Washington, D.C. helped out. They helped bring chains so people could chain themselves in the Capitol when they were fighting. They helped bring food when they were doing the Capitol crawl, which is a well-known crawl. Disabled folks crawled up the stairs of the Capitol building to get the ADA passed in the United States Senate. It had passed in the House. You have to pass 2 chambers in this country to get it done. They did that for 2 days. And it was the Black Panthers who brought them breakfast, lunch, and dinner. Now, this is talked about in some films, and that's how I found out about it. When the Black Panthers had their 50th anniversary, it was there. Not the disability rights community. They don't talk about that. You will watch many disability films and documentaries. They are all from a white perspective. This summer, many people might have seen on Netflix, Crip Camp. It is from a white perspective, a white person. There are 4 Black people in the movie. You don't know their names or what they did. Don Galloway, you will see him standing next to many of the white disability rights activists. He's a Black man from San Francisco. He was there helping out with the fight for 504, but they don't mention Don. They don't talk about him. So that's the erasure of Black people. Finally, the real erasure I see all the time, and it really hurts me, is people will refer to the Olmstead case, which is a United States Supreme Court case that was done that said you cannot institutionalize people without their permission. It connected the ADA Title II to this case. The case is really the Olmstead v. Lois Curtis. Lois Curtis is a Black woman from Georgia, Atlanta, Georgia, the state, not the country. And she wanted to be free. She was born with a disability and put into an institution because of those ugly laws. And when the ADA passed, she got together, her legal team and friends and social workers said, okay, we're going to get you out of this. And she wanted out. And she fought to get herself out. Her case went all the way to the Supreme Court. Yes, there was another person with her, plaintiff along with her, who unfortunately has passed away, but Lois Curtis is still alive. She's the lead plaintiff on here, and they never mention her. They never talk about Lois Curtis and her Blackness and a Black woman who wants to be free. This is how you erase Black people. So with that said, also in Washington, D.C., where I am doing policy, there are about 122 civil rights, disability rights organizations. There are no people of color. I'm the only one. I don't work with them anymore, but I used to, but I'm the only person of color. Not, anything else. No Indigenous folks, no Latino, Latinx, no Asian American who work on disability policy. It is all able-bodied, upper middle class white folks who do this work here in Washington, D.C. And so a lot of young disabled folks came to DC to do fellowships and to work in, policy, as well as all around the country. All you will see are white people leading the disability rights movement. And out of that anger and out of that frustration of trying to work with the community and getting nowhere, Mia Mingus created the Disability Justice Movement. And Disability Justice Movement has 10 principles. The first principle is intersectionality, which I'll discuss in the next slide. And the 10th one is collective liberation. What you will see in the disability rights community is you will never see either number one, or the 9 in between accepted in the disability rights community. The first one is intersectionality, which is a critical race theory and deals with Black and brown folks. You can't do intersectionality when all you have are white people sitting at the table. And it's not just race, there's also a situation, an issue and concern around xenophobia, as well as homophobia in the disability rights community. So we all work on this. And in disability justice, we don't believe in that. We believe in collective liberation, which means that any laws and anything that we do, we will make sure that it protects, and it is a holistic law to include all people.
And Dara, I wrote a question in the chat. So Daniel, do you want to, because I want to make sure, Daniel, you want to?
Go ahead and read the questions.
Okay. Okay, which one would you like me to read? There's a couple of them. Okay, let's go with this. And what made you decide to get into this work? Also, is the reason why there isn't Black and brown visibility because of funding streams and where they are generating in the USA?
Sure, very good questions. What made me want to get into this work is that I work in social justice, and I do have a personal experience with disabilities. My grandmother had a disability, as well as several other people in my family. And I wanted to uplift and make sure that disability issues are always at the table and in the conversation. And no, it's not a funding stream issue or concern. There's plenty of money here in DC. These organizations have purposely chosen not to hire Black and brown people for those positions. This is what is called blocking, and it's called creating a world that you want. For example, a policy position will open up in these organizations, and what they will do is not even send out the job description and not even say, oh, we're looking for someone. They have found the money, want the position, and they already know who they want for the position. Now, granted, that is illegal in the United States, just so you know. You're supposed to send out and interview a group of people. So they'll interview 5 or 6 people and then say, oh, this is who we wanted. So they purposely, it's intentional to do this. It really doesn't have anything to do with money.
Yeah.
So it's unfortunate for that. Now, I will say this, there are no national organizations who center Black and brown people in DC, not yet. We are currently working on that. And so there's some funding issues. It's starting something new, right? And saying, we want to have this done. That is where we're having some concerns and issues, but we're working on it. We're getting funding together. We're talking to funders. If you know anybody out there, please send them my way. Because also we want that organization to be, right, run by Black disabled people centered, right? And then some BIPOC people as well.
And
so thank you. Are there any other questions?
I had one more, and I'll just, is a reason why you think that is because like what we face, with no labels, no walls, going back to this whole idea that we're not just one thing, that generally when people think of Black and brown people, they think of social justice, criminal justice, but yet they want sort of a white, kind of a white face. It's like we can't even really imagine because we imagine, because of how Black and brown people have been depicted in the media in the United States, that they might be other than just what, you know, we've been told for so long? Do you think that has anything to do with, I guess, the kind of whitewashing that you've experienced with the disability movement?
So there's two folds to that. Very good question, Michael. I would have to say no. It is in the disability rights community. It is specifically racism. Like I said, it's purposefully done because for many years, I know I've been doing this for almost 11 years, and there were people before me, right? The disability rights movement is really about, I would say, almost 50 years old now. It was because 1976 is when they did IDEA, which is an Individuals with Disability Education Act. And so Black communities have been talking to white disabled communities for years, telling them this, and they choose not to listen. And they can, because when you also do things insular, you only speak to each other and right? No one's calling you out. No one's holding you accountable. That's when things change. I think the change has come because you have social media, right? Now people, it is very difficult for you to do things insular and be quiet when you have social media, when someone can call you out, when someone could create a hashtag that says disability to white. That, therefore, now the whole world knows about it, right? But before, it was just their little insular community. They were doing what they wanted to do. Nobody's asking any questions. And I also want to be very clear, it also goes the other way. In the civil rights community, you don't see them doing a lot of disabled work, right? A lot of work around helping disabled people. Why? Because whenever you do this kind of work, as you were saying, no labels, no walls. Well, when you have a meeting and you say only these people are invited to the table, there goes a wall and there's a label, right? You are not worthy enough, or you are not smart enough to be at this table, or you are not part of this conversation. And I'm not saying that all people do this on purpose. It just happens that way. But also, that's what Senator Kennedy used to say, if you're not at the table, right, you're usually what's on the menu. Okay, right? So if you're not at the table, and this goes for everything, and I center this in my work, is the fact that if you are creating a program, a plan, or a legislation, and you don't have people who are directly impacted or lived experience, right? Or your table is homogeneous. It's all white, it's all able-bodied, it's all people from the city and not people from rural areas, right? If it's, all of this Christians and no Jewish people and no Muslim people, or no people who are, agnostic, don't have any faith at the table, making those decisions is wrong. Your whole program is wrong because you have done exactly what we're saying. You have put up a label, you must be this, and you have put up a wall. Unless you have the key to get in, or I show you where the entrance is to get inside this wall, you can't be here. And so we don't function from that. That's not collective liberation, right? That is like, collective liberation means that here's the table, everyone is invited, let's have all the voices together. It is much more difficult work, but nothing in life worth having is easy. Right? It's like the person said, how did you get to Carnegie Hall? Practice, brother, practice. I had to practice to get there. Well, how do we get to the wonder I was talking about at the beginning of this, that the world that we want, it's going to take, right, struggle. And struggle gets you there. So that's how I see it, Michael. I hope that answers your question. Yeah. Are there any other questions?
Yes, there's one more question.
Sure, of course.
It says, I guess that would then go to a larger topic of visibility for Black and brown people besides just social justice issues.
That was mine, Daniel. I just
asked.
Yeah. I'm asking so many questions. I'm just
And don't be shy out there. Ask your questions, please. Okay, I'm going to move to talking about intersectionality and multi-marginalization. Intersectionality is a critical race theory who was put forth by Kimberly Crenshaw, who is a wonderful, she's my very good friend and sorority sister. But she is also a phenomenal critical race theorist and civil rights lawyer. She teaches at two very prominent law schools in this country. One is at UCLA, which is University of California, Los Angeles. and the other is at Columbia Law School, which is New York City. And she's executive director of the African American Policy Forum. Please follow her work. She is also one of the co-founders of the hashtag Say Her Name, right? Because in this work, right, we only talk about men who are brutally killed by police officers. And that's how Kimberly Crenshaw and I came together, was to include disabled folks, right? That many disabled people who are killed by the police are also Black and brown. Many of the names you hear, like Eric Gardner, right? Sandra Bland, they had disabilities. So that's Kimberly Crenshaw and intersectionality. And when she put this together, she was in law school at Harvard Law School and Harvard University in the United States. And what she did was she said that Black women were even more marginalized, even more than Black men. It was a GM, General Motors, which is an auto company here in the United States. They make cars. And the Black men had gone to court to sue that they were being paid horribly. And then the Black women noticed they were being paid less than them. So being a Black woman in this country, in the United States, probably, all around the world, is worse than being a Black man. And so that's the intersection of being a woman and being Black, the race and the sex. And then what we do is we've added things onto that and say that people are multi-marginalized, right? There are multiple marginalizations. We don't multiply them, we multiple. They're multiple. It's a short for multiple. And so that's my next bullet. It said, people with disabilities are all parts of life, right? Race, religion, multiple socioeconomic status, incarcerated, formerly incarcerated. That's multi-marginalization and discrimination. Think of an African-American, trans woman, Muslim, refugee, formerly incarcerated with a disability. They exist, and we must, as we were saying, collectively liberate all of those marginalizations whenever we do our work. So that's how intersectionality is, the number one principle in disability justice. In my work, I work with equity activism, which means, many people try to use the same, equality and equity are the same, and they're not. Equity is the quality of being fair and impartial, where equality is I'm trying to be equal. And I don't ever want to be equal to anyone. None of us are going to know, no walls, no labels. We're all who we are. No matter what you are, I don't want to be equal with you, right? But I do want to be treated fair and impartial. So the example we use is if you're trying to create a bike program, and people will create bike programs that you can ride around the city. Number one, so in the United States, none of the bike programs in the United States were that were created, were accessible. All the bikes were for able-bodied people. Yeah. People with disabilities ride tricycles and hand bikes. And so if you come to the United States and you want to ride one of these city bikes, they chose not to do that, right? That's not equity. That's not fair and impartial. And it also is against the law. It's against the ADA I just told you about. So if you create a program with equity and fair, like I said, they didn't have disabled people sitting at the table when they made that decision. And so if you had those people there, you create a program, a bike program, that's for everyone, right? Not just for those who are able-bodied and can ride, and not only able-bodied, but could afford to stick a credit card, put an account on your credit card. There are people who don't have credit in the United States, they're not able to do that. So they couldn't use, right? So there's all kinds of discrimination that happens when people create programs, especially biking programs. And then the other, not just to ride the bikes, in the United States, we have what's called bike lanes, where the lanes are set up so that cyclists can ride their bikes and be safe from, hopefully, traffic hitting them or something like that, especially on a busy street. Those bike lanes are not wide enough for the tricycles and hand bikes I just said to you. So therefore, and I do transportation as one of my issues, and I have been fighting this. You received federal funds to do that. You are violating 1, 2, 3 civil rights laws when you do that. Title VI of the Civil Rights Act, which covers transportation, the ADA, and 504, which I just explained to you, because my people who are disabled can't use the bike lane. Where is the fair? That's not fair and impartial. So that's equity activism. That's how I do my work. And those are my 2 bullets there. if you're planning programs, so you know. And then collective liberation is, like I said, you leave no one behind. So you would not create a bike program, you would not create quote unquote safety bike lanes without talking to all the people, right? And making sure it was fair and equitable. I don't, if you use equality, who defines what's equal? No one.
True.
So that's why we don't use that.
Great. That's
So I'm going to talk about what's been happening in the last couple of years, and even before the George Floyd whole, and Breonna Taylor whole blowout, and even COVID in the United States. So we have disability justice and Black people being centered. So let me talk about the ADA and its celebrations. So as I said, the ADA is 30 years old. When I came into the movement, the ADA was 20 years old. And I remember going to all the events. Back then, even it was George W. Bush. I'm sorry. It was Barack Obama had just come in. George W. Bush, though, he did events too while he was in office because his father signed to the ADA. But all administrations did parties and events to celebrate the ADA. Every Department of Justice, Department of Health and Human Services, they would have parties and events to honor this. And they would have panels of conversations of people who helped with the ADA. Every last person was white. Not one person of color was honored. When they had a cake, every year they have a cake, a large sheet cake that has the names of the people who helped with ADA from Congress. So like Senator Kennedy, Ted Kennedy, who passed away, Senator Tom Harkin, Representative Jim Sensenbrenner from Wisconsin, and Representative Steny Hoyer, who's right, they're both still in Congress right now. Steny Hoyer is the second in charge in the House of Representatives after Pelosi. He's the majority whip. All of those people, but they never had the names of Black Congress members, like a Shirley Chisholm, who helped pass the ADA, even though she wasn't in Congress. But remember, they tried to pass the ADA multiple times. She left Congress in 1989, but she helped before that. Or Barbara Jordan, right, who was, Black woman, also disability. She had a disability, and they both are my sorority sisters, they're Deltas. And then, you had Major Owens, who was the chair of the Congressional Black Caucus, who gave money to Justin Dart. You will see a picture of the ADA being signed, and he has a cowboy hat on. That's Justin Dart. He went around the country to talk about the ADA and get it passed in some states. What you can do in this country is get state level bills passed, and then it'll usually go to federal. And he did that. And how he did that, he had money, as you were saying, funding, that Major Owens, a Black man, helped him get in Congress. And yet they were never celebrated or anything. So here we are. Here's the 20th anniversary they did that. The 25th anniversary they did it. And finally, Black people, we said, nope, enough. So for this 30th anniversary that just happened in July, there were multiple events that were created by and for Black disabled people, as well as BIPOC, as well as Indigenous community, as well as people of color, Latinx, the Asian American. And this is just one of them. Carrie Gray, when you go to her website, you'll see she's created the National Multicultural, right? She created an event that had no walls and no labels, except for make sure you are going to uplift everyone, right? And centered BIPOC people, right? And so she had that celebration, decolonizing dreams, right? Because they had this dream of no walls, no labels. They did no labels, no walls. They didn't want that. They don't want people to do that. The only kind of label we want is to love, right? Is that we're going to love each other, and that we're going to center each other, and that we're going to center Black and brown people right now, because that's how we feel right now. But you will see in the pictures, there are all kinds of people who came to the event via Zoom to talk about this. And you can, she has archived the events on her website, so you can see that. And there are some other ADA 30th anniversaries. If you Google ADA 30th anniversary BIPOC, and you'll see at the top here, where it says BIPOC. That acronym is Black, Indigenous, People of Color, for those of you who don't know. But if you put that in Google, you'll find some ADA celebrations that were done. They did a couple of Facebook events. They did LGBTQ community did something, formerly incarcerated community did something, right, around the ADA. So that's how we chose to do that. And then, unfortunately, after the killing of George Floyd and Breonna Taylor, this group and this community also came together and created Black Disabled Lives Matter. And you will see the artist who created this is Jen White Johnson, and you'll also see her Twitter account. You can go to Jen. Jen and Carrie work very closely together. It was really Jen and Carrie Justice Shorter, who put this together. In fact, if you looked in the United States, a couple of weeks ago, they did in August, they did the March on Washington, the anniversary for Martin Luther King coming to DC. Reverend Al Sharpton and National Action Network did that. And two of our Black disabled activists, Carrie Gray and Justice Shorter, who created all of this work, spoke at that event. You can also Google that and go on YouTube. They spoke at that event. We made sure that, the civil rights community embraced that, and Reverend Al's team was right on board. They called me, they said, Dara, you got some people who can speak? And I said, yeah, we sure do, right? No labels, no walls. They had all kinds of people speaking at that Martin Luther King March on Washington, because Martin Luther King said he wanted to change for all people. So I'm going to stop and see if there are any questions.
Okay, Dara. Well, thank you very much. Very interesting indeed. Actually, this is one of my questions, because sure. I have been working with people with disabilities in various different countries, including the States, actually. And I've always wondered, can disability history be integrated into the school curriculum, or is it already, or Black and Brown disability history as well? Is that pushed, or? Because I guess it's visibility of people with disability, isn't it? That when I'm with people with disability, it seems like there is a lack of understanding, or people are treated like children, for example. They have never really come across many people with disability. So yeah, carry on, Dara.
Oh, sure. No, that's a great question. So the answer to your question is yes. And we have a movement to include disability history, visibility, as you're saying, into curriculums. Only one state in the United States has passed this law to be a part of their school curriculum. That's California. As if you know the United States, California is always kind of like, if California does it, then the rest of the country will do it. Well, sorry, not on this one. That didn't happen. But there are also many. So the California law is for, I think it's middle school. It starts at which is sixth grade for us, about 11, 12-year-old in the United States, through high school, and they are to learn disability history. Now, what that looks like has been changing as well. It was all white, but we've been able to infuse some of that into the curriculum. Now, on a higher ed level, which is university level for people around the world, that means out of secondary school or out of high school, where you're getting your college degree or Bachelor of Arts, Bachelor of Science degrees. There are a number of disability rights programs around the country, about 10 or 12 of them, who just center on disability rights. And now there are about 6 or 7 graduate programs who center on a study for your PhD, your law degree, that is centered on disability. So that is starting. It's interesting when you say that. In here in DC, many people are lawyers. Like a lot of people who do this work are lawyers. I'm not. So, and I love the lawyers, but okay, I am not. I have a master's in public administration. Thank you, in public policy. And I was, doing work as I did, and talking to my lawyer friends who outside, like civil rights stuff. And I would say, well, no, because the ADA says this. And they were like, oh. And I was like, you don't know the ADA? And they were like, we never got they were in law school. My one girlfriend told me they had a paragraph of the ADA, and that was it. Yeah. One friend told me she had 3 pages of the ADA, and that was it. And I was quite shocked. I was like, oh my gosh. So that's changing because, you know, it is a civil right that all lawyers, right, should know. Why don't they know this law? So that's changing. And, you know, I always tell people, always ask me, you're not a lawyer. I said, no, but I can read, right? This just amazes me. I'm like, no, but I can read, and you read laws. So that's how I know the laws. So that happens. And then to also with your question, and it goes to this whole conference, right, is that you can't know people if you constantly label people. If you constantly say, oh, well, you know, he's the such and such over there and she's this, that, and you don't know people. And you're right. I roll around with my friends, well, before the pandemic, you know, going to dinner, going to baseball games. I'm very comfortable. I have been around disabled folks, as I said, all my life. My grandmother, my mother's mother was in a wheelchair all of my life. I have 2 cousins who are deaf. I have about 4 cousins who had MR, as we, you know, back then. Now it's DD, developmental disability. And they played with us. They went out, you know, we played baseball with them and softball and soccer. And the only thing my grandmother said was she doesn't go to the hospital. So that meant those kids better be okay when you come home, right? So, but I say that to say, you know, you can only know about people if you're with them, right? You know, I know about my Jewish friends and faith because I have several friends who are Jewish, and they would invite me to Seder, and they would invite me to Rosh Hashanah. I know all of those celebrations. You know, I know so much about the trans community because I did not know anything about the trans community, and I made it my business to go to my LGBTQ friends and say, how do I learn about transgender community and what it means? And they steered me towards those groups. You cannot sit in your room and you cannot sit in your community and not know about other people. And the same thing goes for disabled. You won't know about disabilities unless you're around disabled folks.
And it's
Michael, go ahead.
It's just so great because the only way to reach new audiences is to meet them where they're at. And Dara, you're just, every time you speak, I just get so excited. So you might see me dancing.
No problem. I'm excited too. I'm so excited. Woo! Because we're going to change the world, right? We're going to do this, you know, but it's true, you know, and like I said in my example, I reached out and said, what is transgender? What does it mean? How do I find out more about it? Not they got to come to me and tell me, right? No. And guess what? That community had no labels for me and no walls for me. They said, come on in. We'll seat you. We're greeting you with love, right? As you said. And so if you don't know about disabled people, that's why I can sit here and tell you, and I hope you take this away, there's nothing wrong with having a disability. And that's why people have a hard time. They go, oh, well, really? But because you're not there yet and you need to go. You need to see, you know, disabled people are parents. Right. That's the other thing. People like they have sex. Yes, they have. Like, I'm like, well, I don't understand. Why don't you think this? Like, there's no science that says that a woman with a disability doesn't get all the things that a woman gets, and a man with a trans, whatever, that they don't get those things. They also are LGBTQ, right? They have different partners, right? They do all of these things. So I don't understand why people don't think that. And then there's also this whole concept of institutionalization. So let's be very clear about institutionalization. And I want to talk about it because I don't want it to be lost here that people with disabilities in the United States are still institutionalized through nursing homes. And right now in the COVID, pandemic, we had a couple of things. One is in the United States, they did what's called treatment rationing. And treatment rationing comes from World War II. If you watch or read about World War II, it really happened around Pearl Harbor. And when Pearl Harbor happened, there were so many people who were wounded and hurt, but there weren't enough clinicians to help all of them because Pearl Harbor was kind of a very quiet harbor. Right. So they might have had like 10 doctors on call, there. It wasn't a battle place. It wasn't a place there was a place where they came and they left. And so they didn't have a lot of nurses and doctors to take care of all the people, like 5,000, 6,000 patients that were coming in. And so one of the doctors told the nurses, look at the person, evaluate them. And if they are not harmed so badly, put a T on top of them for treatment and put an L on top of them for loss, right? Like there's nothing we can do for them. Just let them die. That's treatment rationing, right? Because you're rationing the treatment, right, that could come to people. Well, that has stayed around. And unfortunately, what doctors in this horrific pandemic had to decide was, is this someone we want to take care of? Is this someone who is valued enough to live? And that is horrible, right? For you to decide because someone is on, if they came in with a breathing mask and they had COVID, that person is not, as valuable as this 26-year-old, athlete, male, white guy coming in no, let's try to save him over her. So that was treatment rationing. And let me just say this, of course, it was Black and brown bodies at a higher rate, right? And again, the disability rights community did a whole panel and conversation on this with all white people. And I wrote about this in my blog, which I'll show you guys in a minute. So I say that. And then the second part of it is the nursing homes. In the United States, nursing homes, almost 26% of the people who have died from COVID died in nursing homes. The New York Times wrote about this. The highest level of positive cases of COVID are in nursing homes, congregate settings, nursing homes, jails, prisons, and detention centers. And we are telling these governors, get these people out, and they're not doing it. But nursing homes, in general, people with disabilities are in the nursing homes against their will, and that is not the ADA or the Olmstead v. Lois Curtis case. And at a higher rate is Black and brown people. So you understand and know that. I'm just going to go through my last couple of slides and talk about it so you guys know this is disability rights in the United States. This is a march and rally that happens every year, the National Council of Independent Living. I work for ACIL, which is a Center for Independent Living, a non-residential center where people with disabilities go for advocacy, for fellowship, for services. Every year they come together in Washington, D.C., and they do a march and a rally. They put together their signs. You see this, it says, "You have the power, live the dream." Generation ADA. They'll have nursing homes, not our homes, not nursing homes. They have disability rights, it's civil rights, and they march from the hotel to our United States Capitol. This is our United States Capitol right here, where our Congress meets. That's where they vote and everything. These are pictures of people rolling in the march. You will also see sign language interpreters signing whatever chant we're saying, right? No labels, no walls. We don't put anything up. People come, you'll see here. So this is us marching again. This is in 2018. We march rain or shine. You see it's raining. You can see people have their rain ponchos on. We don't care, right? There's no weather. Weather doesn't stop us, right? We're kind of like the Postal Service. We're going to keep right on going. Rain or shine, we're out there. And over to your right, you'll see Yoshiko Dart, who is Justin Dart's widow, who I was talking about earlier, who is a woman of color, right? Asian woman who was his partner in the work. They don't speak of Yoshiko as his partner, but I do because I love her and she is my kindred spirit. We're born on the same day, many years apart, but we're born on the same day. And that is Representative Jan Schakowsky, who is one of our great strength people on the Hill, who fights for disability rights better than anybody I know. And she is a Democrat from the state of Illinois, which is where Chicago is, for those of you around the world, Chicago, the city. And that's actually where she's from. And then this is another year where we were leaving the hotel, and these are kind of leaders in the front who you'll see. And then to your right, it says Medicaid equals life and liberty for disabled. That was the year we were fighting the ACA, the Republicans in Congress were trying to get rid of the American ACA, the American Affordable Care Act, the Affordable Care Act, which had Medicaid in it and some really good Medicaid strong language, which is the insurance that disabled folks can live in the community. They get their community services through Medicaid. And so that's kind of those pictures of us in front of the United States Capitol buildings. They marched to, let me go back up so you can see. So they marched to the Capitol. We have lunch because we make sure people take care of themselves. And then we have a rally. And in that rally, we usually have about 30 to 35 both House and Senate members, the actual members, come out and speak to the crowd because they love to speak to their states. You can't see it, but the people are grouped in their states. we usually go in alphabetical order. So like Alabama, Arizona, Arkansas, Texas, right? They're all out there. And those members love seeing their people from their states. So they do that. Once we finish that, they go to the House and the Senate for meetings, because it is important to advocate for what you want. You have to tell your legislators what you want. So that's what that is. This is a universal kind of, information about disabilities and how it's used. This is on disability etiquette. I just really want to talk about this. So as you all know, language is fluid, excuse me. And also, this is the United States. I know, especially in the UK, it's very different. And I've learned that because I do international work. But this is for the United States, so you understand this. I create this chart. The last time I updated was 2013. I would have done it this year, but we didn't meet in person. At that NICL conference, we sit and have focus groups to talk about language and tell us what we should be using. When I first started working in disabilities, we didn't use disabled. Now you hear me saying disabled people. The reason we didn't use disabled back in 2013, and it's been years, the young people and people have empowered disabled. We didn't use it back then because people like disabled car on the highway or disabled machine. It wasn't empowered. Now they have empowered it. And so they don't mind using that word. I would tell you to ask people which word they like better. When I write though, I write in person centered. So it has to be person with a disability. We never use the word impairment. We never use impaired. Because again, there's nothing wrong with having a disability. So when you say visually impaired, that means there's something wrong with them. There's not. So we use blind or low vision, deaf or hard of hearing. We don't say people are confined to anything, no labels, no walls, right? They're not confined to that wheelchair. It is a wheelchair or a scooter user. We say people with intellectual or developmental disabilities. And we please stop using the word crazy as an adjective. People say, oh, we're living in some crazy times. Oh my God, that man is crazy in the White House. Stop it. That is a harmful rhetoric to disabled people.
True.
If you're educated, this I'm gonna say to you, you have a vocabulary. Use it. Say what it is. We are living in horrific times right now. We are living in chaotic times right now. That man in the White House, for us, the United States, is a misogynist, is a xenophobe, is right, a racist. Say what he is.
We can all agree on that.
Don't use crazy, right? Don't use that. Don't use that term, because our people with mental health diagnoses, they're not going for services and help. Would you go for services and help if someone is comparing you to that man in the White House?
Yeah.
No.
Dara,
so stop doing that. So I'm going to stop right there.
Okay, Dara, thank you very much. There's just a couple of minutes left. So that was a brilliant talk. I must say, it was amazing, very inspiring. Is there anything quickly that you could tell us, like what can we do?
Yeah, sure. So I'm sorry, I'm going through my stuff here. I have also put in here my information. Sorry, where is it?
Okay.
Oh, okay. So I am, these are some of the things that I have done over the past couple of years. I just did a podcast with Crip Chat in UK. So listen to that where we have information. And then what you can do is just join us either through social media. Sorry. Oh, there you go. Or you can contact me. This is my information. We can always use any help on our fights that we have. Okay. I want to say thank you to everyone for being with us. There's a lot of work to be done.
Information slip back so I can copy it down.
Yeah. Sure.
Thank you.
Yep. And then, like I said, this will be on the slide. And I also have a blog post if you want to follow. It's called The WIYAT, the WIYATT. And you can also put my name in Google. I think it'll come up, The WIYAT, where I write about what I just talked about. So
maybe we can put all this information on the Facebook group. We can share it.
Daniel, excellent. Oh my God, that was so enlightening. Thank you so much.
Can you plug the next event, Daniel?
Sorry?
Say it again.
Plug the next event. What's coming up?
Thank you so much,
Yeah,
Dara.
thanks, Dara. Yeah, we're just going to have an introduction now for the next event from
Thank
Marcus. Yeah.
Peace and blessings, everyone.
Yeah, thank you.
Peace and
Thank you very
blessings
much,
to you
Sarah.
too. Thank you.
Brilliant. Excellent.
All right, you're
Excellent.
awesome.
Okay, thank you.
Mazel.
Welcome to the No Labels, No Walls, plus We Are One